Imagine your heart, a magnificent muscle, tirelessly working to keep every part of your body running smoothly. It is constantly pumping, adapting, and sustaining life. But what happens when this incredible engine faces a challenge, and how do we accurately and quickly understand its condition? Specific cardiac enzymes are tested for heart conditions because their elevated presence in your bloodstream is a direct and definitive indicator of damage to the heart muscle. When heart cells are injured or die, they release these unique proteins, which then circulate in your blood, providing crucial clues about what is happening within your heart. At the core of this diagnostic approach is the fact that heart muscle cells, or cardiomyocytes, contain certain proteins essential for their function. When these cells are damaged, for instance during a myocardial infarction or heart attack, their cell membranes become compromised. This damage allows the intracellular contents, including specific enzymes and proteins, to leak out of the cells and into the surrounding interstitial fluid, eventually making their way into the bloodstream. The most well-known and highly specific of these biomarkers is troponin, particularly troponin I and troponin T. These regulatory proteins are integral to muscle contraction. Another enzyme, creatine kinase MB, often referred to as CKMB, is also released but is less specific to heart muscle than troponin. Myoglobin is another marker that can be released very early, though it is not specific to cardiac tissue, meaning other muscle damage could cause its elevation. The pattern of releases, including when levels begin to rise, peak, and then decline, provides valuable information about the timing and extent of the heart injury. When a healthcare professional suspects a heart condition, especially a heart attack, a simple blood sample is taken. This sample is then analyzed in a laboratory to measure the levels of these cardiac enzymes. Since these enzyme levels rise in a predictable pattern after cardiac injury, multiple blood draws over several hours may be performed to monitor their trend. This careful monitoring helps confirm the diagnosis, assess the severity of the damage, and guide immediate treatment strategies. For example, consistently elevated or rising troponin levels are a strong indicator of an acute myocardial infarction. This precise method of detection represents a significant advancement in cardiac care. Prior to the widespread use of troponin testing, diagnosing heart attacks relied on less specific markers, often leading to delays or misdiagnoses. The development and refinement of high-sensitivity troponin assays, for instance, now allow for the detection of even very subtle heart muscle injury much earlier than ever before. This rapid and accurate identification of cardiac damage empowers medical teams to intervene more quickly and effectively, which is absolutely critical in conditions where every minute matters. Ultimately, testing for specific cardiac enzymes provides an invaluable, objective window into your heart's health. By understanding the unique proteins released when heart muscle is under distress, healthcare providers can swiftly and accurately diagnose conditions like heart attacks, distinguishing them from other issues that might present similar symptoms. This precision in diagnosis allows for timely, life-saving interventions and vastly improves the long-term outlook for individuals experiencing cardiac events, ensuring they receive the best possible care when their heart needs it most.